All right, hello everyone. I'm Dr. Rendi Murphree, epidemiologist and Director of Disease Surveillance and Environmental Services at the Mobile County Health Department. It's good to be back here with you again after a while being from working at home. So I just want to give a brief update. First of all, I want to thank Mark Bryant for the work that he's doing to provide this daily update. Even when many of us are working from home, Mark thankfully has been doing that from home some of the time. And so I'll just report, and we usually give the update of cases. So, we have over 368,000 cases in the United States now with nearly 10,000 reported deaths. Alabama is reporting on their public dashboard 2,105 confirmed cases with 56 deaths. In Mobile County, that dashboard is demonstrating that we have 176 confirmed cases with 6 reportedly died from COVID illness. So again, we are seeing the number of cases rise as we are starting to see more and more transmission in our community. So that number is going to rise. You may have seen some of the prediction models that have been put online by some really smart people and some international agencies, and so the peak in Alabama is expected to be around April 18th, something of that nature. But again, that would just be sort of the highest point in the outbreak that we would have cases relying on healthcare and illnesses and deaths. If that is true and we peak in mid to late April, then we will just be to the top of our curve, and we'll still have the downslope of the curve, which will take many weeks and months for us to try to get back, hopefully, to more normal times. So hang in there. Thank you for what you're doing to adhere to the public health recommendations, to stay at home, to not only go out for necessities, to protect yourself when you have to go out for groceries or medical visits, and it's going to take us all coming together as a community to get through this. I just wanted to mention that the Mobile County Health Department has been providing a daily update on the characteristics of the COVID positive cases in Mobile County for some time now. And we just heard from the state health department that they have begun to do something similar. So this report is now available online, so you can check alabamapublichealth.gov and see the breakdown of the characteristics of the COVID cases that are being reported statewide. So I wanted also to point out a couple of other things that we are hearing from our federal partners at CDC. So yesterday, CDC published the first report to look at COVID-19 illnesses in children, and this was reported in the Morbidity and Mortality Weekly Report that CDC has. It's a public document, so anyone can go and take a look at it. And it states that while some children with COVID-19 may have mild illness and may not show symptoms, they can still spread the disease to others. It's important that people of all ages follow recommendations from CDC and state and local public health authorities to help prevent the spread of COVID-19. So this is just another in a line of publications that we have seen recently that demonstrate that there is asymptomatic spread of COVID-19. Patients who are what we call pre-symptomatic, so they will develop symptoms but they haven't quite developed them yet, that these people can potentially can spread virus, so they can be contagious even though they don't have symptoms of COVID like cough or shortness of breath or fever. So I want to make sure that that's clear. That's part of the reason that CDC made the recommendation that anyone who is moving about the community, that a community like ours that has community spread, wear a mask to protect yourself. That was not something that we were doing a few weeks ago, but based on the most recent data and science, that is now a recommendation. So, remember, stay tuned because things change dramatically as we're learning more about this unprecedented and unknown previously to us coronavirus. Also, I want to say that, we are now in the accelerated phase of the outbreak nationwide. There are 29 states that are reporting widespread community transmission. The number of COVID cases reporting to the U.S. is rising quickly. So early on, most of the cases that were reported were due to travel to other countries or other areas where transmission was widespread. But now, more and more cases are resulting from community spread where the source of exposure is unknown. So I just wanted to make that note, just to point to make sure everyone understands that we're probably, the days of us asking you, did you travel to another country or did you travel to another state, are behind us, and now we are not able to determine where you may have been exposed in the community in many cases. I think nationally there are some 300,000 cases that where the exposure location or the person that may be infected, new patients, is unknown, or we're still investigating. So also this week, actually not this week, it was on Friday, CDC started producing what they call the COVID View report. So you can just Google CDC COVID View, and that will be a weekly, very detailed report that summarizes and interprets key indicators from a number of surveillance systems having to do with influenza-like illness and COVID illness. So if you're trying to stay up on the latest, you can look for that weekly publication from the Centers for Disease Control. So let me set that aside. And I need to give a shout out to Trina and Billing. She's been asking me every day to send her a shout out. So thanks, Trina, for what you're doing behind the scenes to keep our health department moving forward. I get lots of questions about reinfection, and I just spoke with a reporter today about, can a person who has COVID get it twice? We know that people who are infected with COVID will build antibodies, or their immune system will respond and build these biological materials that we call antibodies that can help protect from infection, or this is the way your body fights off the infection when you have the virus circulating in your body. So we know that people their immune system will respond and produce the molecules that are needed to provide some protection. What we don't know is how long that protection might last, if it will protect fully or partially, if it will protect against other common cold coronaviruses. So that's where the science is still outstanding. So I'm just not able to provide a definitive answer to that, but I just want to restate that we know if people who are infected are building defense antibodies to that infection. And some clinical trials, patients who have had COVID infection are volunteering to let scientists retrieve those precious antibodies from their system and see if they can be a treatment or a cure for people who are newly infected. And many times when we face new illnesses like this, it's often our healthcare workers that become infected and recover that we rely on to work on the front lines of new cases and in hospitals and those sorts of things, because they have a level of protection that the rest of us don't. So just keep that in mind with regard to, can you get it twice? We're still sort of waiting to see the science and the data around that. Right now we think the answer is no, but we don't know to what extent you will be protected after your first infection with COVID-19. Now, I mentioned about healthcare workers. I'm on the phone, and many of our leaders at Mobile County Health Department are on the phone all day, every day, talking to hospitals and long-term care facilities and testing locations that are having a difficult time keeping their facilities staffed with the healthcare workforce that we need to keep people well and provide the level of care that they're accustomed to. So I just want to make a plea to all of the healthcare workers that are working throughout Mobile County. If you are healthy and well, please report to work. Follow the guidance of healthcare providers, but we need every able and healthy healthcare worker to be working and helping us support sickness and disease in our community during this unprecedented time in our history. So again, if you have underlying conditions and if you're in some of those high-risk groups, we can put you to work working in healthcare, but not with COVID patients. So again, please, if you have a job in the healthcare industry, please to work to the greatest extent that you can, because we need you out there working in the hospitals and working in our long-term care facilities and other health care facilities. So just a comment about that. So Mark, I'll take some of these questions and answers. Is that?
We'll go with this first one.
Okay, Mark has a question that maybe has come in on Facebook.
They're wondering about the number of Black Americans facing alarming rates of coronavirus infection in some states. Have you seen anything on that, race problems, issues with coronavirus?
Yeah, I don't know national. So the question was, there are some reports out that maybe indicate that African Americans and maybe some other races, markers, are mostly African Americans are disproportionately affected by COVID infections. I've not seen that report, so I can't comment on that, but I will look into it. But in Mobile County, I've been publishing the statistics on the number of African Americans who have positive COVID disease and the number of Caucasians who have COVID disease, and it seems to loosely mirror our population. But I will look into that a little bit more closely and provide some information for a future Facebook Live update. Okay, Mark? Okay. So let's see. Here's a question that came from, it looks like, one of our news partners. Question is, I'm inquiring about what Mobile County Health can do to provide more geographical information about COVID-19 cases. We've been releasing information on the number of cases by zip code to the fullest extent allowable by the HIPAA privacy rule. We have been releasing zip code level data even when some of our other public health partners have not been releasing that. So we're able to release zip code data on, I think it's 5 zip codes, as soon as those zip codes have at least 5 cases. So there are 5 zip codes with greater than 20 population living there, and once those zip codes have at least 5 COVID patients, we're publishing that information. And then all of the other zip codes we have to group by the first 3 digits of the zip code, so 366 and 365. And I understand that there are some other states and organizations that may be providing more detailed information than that. At this time, we're just not able to do that. We're not seeing any geographic clustering, so I can look at individual street addresses for these folks. We're not seeing any unusual geographic clustering. It looks like most of our cases are coming from where we have the greatest population, and we see a low number of COVID patients in rural areas where the populations are lower. So here is a question, also it looks like from one of our local newspapers, that says, there's been a massive drop in Alabama's projected number of deaths, needed beds, and ventilators in the online projection model. This is put out by the IHME. If you want to Google that and look at it yourself, it's www.healthdata.org/COVID. So a couple of days ago, that agency that has done these projections, they made some tweaks to their model, and they took into account the social distancing and the health orders and the closing of non-essential businesses, the number of cases in Alabama, how many deaths we've seen in Alabama, and then what's known about the biology of the virus with regard to incubation periods, duration of illness, that sort of thing. And I also heard, this is an unconfirmed rumor, that they may have had a decimal point in the wrong place. And then our numbers looked much less grim than originally projected. And as I mentioned, I think I might have mentioned this, I wrote this down and was going to say it. So IHME projects that our peak use of hospital beds will be on the 18th of April, but that we will have 0 bed shortages, 0 ICU bed shortages, and enough ventilators to handle that peak. That's based on a projected, so this is all modeling. The more grim statistic from that model is that by August, an estimated number of deaths in Alabama will be greater than 900 people. And so we are really concerned about that. And again, it's just more, recognition that we are still fairly early in the most difficult part of this outbreak, and that's why you need to follow the state health officer orders and your local ordinances to the letter and not violate those, so that we could try to slow down the community spread so that we don't overload our health care system. So that is the question about the modeling. Let's see. So let me skip this one. So we had a question again about zip code. How are zip codes reported when it comes to cases and clusters? The question was, if we had, multiple patients at a nursing home or multiple patients at a detention center, would positive cases be counted by the zip code of the long-term care facility or the detention center? So it goes by the zip code of permanent residence. So if a long-term care facility is a person's permanent residence, then that case would be reported in that zip code. For detention centers, cases identified in people who are incarcerated, again, we would use the zip code of their permanent residence. So that would not be the zip code of the detention center. So hopefully that asks, some of these questions are really quite detailed. Someone's been thinking about these things a lot. More questions about the modeling, if we have enough physician and nurse coverage. Have we noticed any flattening of the curve? Again, this is not our model, but you can go to that website to look at the projections that have been modeled there. Let me say again, since so many people are interested in this model, it is pretty cool, I've got to say. It's healthdata.org/COVID to go look at the prediction modeling for the U.S., for Alabama, and actually any country in the world. So let's see. We had some questions submitted to us from, I'm not sure who, but I'll just go through them anyway.
Yeah, go ahead.
Okay, so let's say someone was asking about the fact that Mobile County has 6 deaths. This was yesterday, and that only 4 had been confirmed in Jefferson County. What do we think we have, a lot more deaths than other areas? Right now our numbers of deaths are really just too small to know if Mobile County is an anomaly from our counties in other states, or in, comparing to jurisdictions in other locations. I think, this is a challenge when you have very small numbers. People tend to, stake their trust in them, and when they move slightly, then we have big fluctuations. So I just think right now the deaths in Alabama are looking very much like the same way that they are in other parts of the state and throughout the U.S., that they are older patients with underlying medical conditions. They become sick with symptoms that are typical of COVID-19 illness. They're hospitalized, and then they die in the hospital. So that is such a tragic and unfortunate situation, but we don't think that there is any reason to think that we will have a higher death rate or different characteristics in our folks that are not surviving COVID infection in Mobile County. Are you seeing any indication of confirmed cases due to people visiting the beaches last month? I don't have any. It's not that I'm aware of, is my answer to that question. I don't have any knowledge. Again, now that we have, wide, community transmission in Mobile County, it will be very difficult to determine precisely where new cases were exposed. Let's see. Someone was asking if the health department was offering hazard pay during the pandemic, and the answer to that is yes, we are providing hazard pay to Mobile County Health Department employees that are involved in direct patient care. This includes providers, provider support, and registration personnel. It's at time and a half, and this is because, again, we have a critical shortage of healthcare personnel that can take care of our sickest patients, and we want to ensure that we have the staff that we need. We're also rotating through our staff. So once staff are working in our sick clinic, they are only working at that clinic, not working at our well locations, but they're sort of rotating through so that we can make sure we keep our staff safe and healthy. Also at the health department, our staff and all of our visitors are screened when they come in. They're asked if they have cough or shortness of breath, and their temperature is monitored. And if they have report, yes, or if they have a temperature, they are not allowed in the building and they are tested and sent home. That's again for our healthcare personnel to make sure that we're keeping people as healthy as we can as we try to serve our community. Let's see. I think that's about it, Mark, unless you have two more?
Any data that COVID patients share a certain blood type?
No, I had seen a report it seems like it was a couple of weeks ago. It could have been yesterday, but there was a report that maybe people with A positive blood had some protection or something of that nature. But when we had one of our nurse practitioners look into that, our response was that that was a small study, I think, that came out of an international group. There has not been corroboration that any one blood type or another is more vulnerable or resistant to COVID infection. But we will, of course, if we find out something like that, let you all know. But it would not change our recommendations about staying at home, only going out if you have to, and with a mask to cover your nose and mouth, and staying 6 feet away from people to reduce transmission.
Last one. Do we know how many people in Mobile County and the state have recovered at this time?
So that's a very difficult question to get at. In fact, everyone. Okay, so Mark said the question was, do we have information on the statewide or in Mobile County on the number of people who have recovered from their illness? We are trying to collect that information. It's, as you can imagine, we have ramped up to do these COVID investigations, and we get more and more and more and more every day. So we have, it's a large challenge to conduct the initial interviews on folks and then identify their contacts and then contact all of those folks and tell them they should be quarantining. And so we have a team that is trying to work to collect that what I call outcome data. So, following back up with some of our early patients to determine, if they were hospitalized, how long they were hospitalized, when did they recover from their illness, and sort of collect some of that information. But right now it's pretty sparse, which is why we're not reporting it daily. But as soon as we have data that I think are accurate and complete enough to provide that to you, then we are obligated and committed to doing that for you. But right now, it's just we don't have that information on enough of our patients to be able to feel confident that the information we're giving to you is accurate. And I guess that's it. So tomorrow and Thursday, Mark, and Friday, I guess too, Mark, you'll be giving the 2:30 update. So we'll continue to have the update this week. I think I will be back on Monday. Mark's not going to be able to be with us that day, so we're still committed to providing these updates live to you on Facebook each day. And keep sending in your questions. And again, thank you to our community, to our healthcare partners, to everyone who's been deemed essential and is still working. We stand with you as a community to try to keep Mobile as healthy as we can, and we will continue to provide information as it becomes available to us.